I'm a social worker by training. I got my degree at the University of Washington, and my specialty was more in community-based mental health. When I came out, I worked at Safe Future Youth Center, and actually that was my first professional interaction with gambling in the form of the kids that we work with at Safe Future Youth Center, where they would always play dice. And it got so bad that they would, play out in the outside the center. They would play in between our activities, and where we had to actually do a policy where they can't play dice on the premise, because the playing one is one thing, but then what happens after they win or lose was was really where the problem was at the time. So I kind of fell into recognizing that how gambling was such an issue in the Vietnamese community as I was working with my clients. It wasn't the primary diagnose or the primary problem that people came when they interacted with me, but then through my work with them, through more of from the mental health side, then I began to see how that was a part of their issues. Culturally competent mental health care is essential in the fact that people won't even, in the Asian community, the access, right? People won't even go to seek service because they don't feel that they're connected. So these are what we call barriers to access and service utilization. And so some of the barriers are access to language. And so if we don't have culturally competent care, then they come there and there's no one to be able to communicate with them. Another barrier that's related to cultural competency is even recognizing the different how culture plays a part in the manifestation of their mental health problems. And so even asking the right things, right, to elicit the challenges and the problems that they're going through. Definitely, there's another component of being able to relate to someone where people feel comfortable and accepted. And so that is how we communicate to our client. We have to be able to understand the different cultural nuances of what is respectful, of what is stigmatizing. And so that helps to build the relationship. I'm so happy that right now we are so intentional about viewing things from a cultural lens and understanding how that the manifestation and the willingness to seek services is really related to their cultural values and beliefs. And I would tell you that I came here when I was 7, and I grew up in Boise, Idaho. And so I grew up in a very mainstream environment where there were not a lot of Vietnamese folks. So I didn't realize that Vietnamese people gambled a lot until I went to the University of Washington and I had Vietnamese friends. And then during New Year, my friends would take like 3 days off, and they're like, "Oh, it's New Year, which is coming up. Lunar New Year to us is Tết. A lot of people might know as Chinese New Year's as well." And so I would realize that my friends would take these days off, and then during that time, they would stay home and they would play these games that were New Year's game, but there's a lot of gambling involved. And one of the most popular one is called Bầu Cua Tôm Cá. And it's really 6 pictures of different animals and sign, and you put money on it, and you shake this thing, and whatever the number of animals or sign comes up, then you get a one-on-one for what you put on there. Kids who are like 2 or 3, as long as they have that lucky money, they are they start to play in the game, and it's a lot of fun, right? There's a lot of noise, a lot of families, very intergenerational. And so, like you said, like part of it is such a cultural norm where gambling, is seen as a cultural tradition in certain time of the year. They also play kind of mahjong, and there's other cards that they play, and you'll see different groups, the women would play together, the men would play together. So there's all these little pockets of games, and we play this all day and night. But then that kind of brings us to the question of gambling, right? So how do we start to pathologize? When is it a problem? When does it become, the word that we even use? And so that's where sometimes when we don't have words for the problem, then it's hard to understand when it becomes like a cultural and a tradition, and when is it at that point where it is starting to have adverse impact in the way that you live, in the way that you interact with your families and your community. So I think unpacking all that, we haven't been, from a research perspective, there hasn't been intentional kind of work in that area. So, as a Vietnamese therapist, I'm always wanted to make sure that we don't take something that's a cultural norm, a beautiful cultural tradition, and make it a negative, right? Make it something that is a mental health problems. And so, how do we differentiate that? And I'm also constantly, now I have kids, I have 3 boys. During New Year, I'm always torn between should I introduce them to this game and where they get their lucky monies. And so, typically they get $20 to sometimes $100, depending on how many family members do they see and how many lucky money they're getting. And so I'm like constantly torn about should we play this game where I'm teaching them to what mainstream know as gambling, or it's really a cultural game, right? But then the essence, what we're doing is, at the very base, you can say that we put money down and we get money back or forth or not. And so there is a high and there's a low. There's a lot of crying, and so that's always, I think, a challenge when we start to understand individuals and start to tease apart, and how do we not stigmatize, their cultural norms and traditions, but then on the other hand, also get people the help that they need when it becomes problematic. In our society, we tend to either think it's good or bad, right? And there's nothing in between. And so sometimes people see alcohol, or a mental health is the same thing. It's either you have it or you don't have it. If you use it or you don't use it. And so it's that extremeness, by that binary approach is, I think, is very problematic. And so how do we normalize a lot of these things and not stigmatize them, but really giving people good coping mechanism to address it when they start to, and then also have preventative and also have services in place that we can do a lot of preventative work before it gets to the end point. About what is it about kind of the refugee and immigrant experience that might increase some of the trend, some of the rise in gambling. And, I will speak to this a little bit more in my talk, but it is really a multitude of factors that come together. So we've talked about how traditionally, different forms of gambling is also different forms of social interaction, cultural norms. But when you think about for refugees and immigrants, the fact that they have gone through this process, this migratory process, especially for refugees, there's a lot of traumas and stressors, and so that they deal with. And so there's a higher mental health problems that come out with, and to deal with the trauma, of course, then, we seek different coping mechanism to deal with the traumas. And so gambling then becomes another coping mechanism to deal with the reality of the world that they're living in, and that reality that a lot of people in the Asian communities are living in is really isolation, right? Disconnection from what they've always been used to. And then, of course, along the way, if we had had a better social support, we might have other outlets or other people to recognize that we're going through a tough time to address that. But then, a lot of folks don't have the same social support that they were used to in their home country. And so I think all those things really accumulate and makes gambling is as an escape, a maladaptive coping mechanism, and then not having the services to provide the support early on. And then when we add stigma and shame to that whole cultural, factors that ties to that, it's just not you. Your gambling does not just impact you, but it really impacts the whole family. And so I think the consequences of when gambling gets out of hand is even more dire for those in the Asian community. So the question where mental health or gambling addiction is a social justice issue, it is totally anytime when people have a disproportionate outcome where a group in America is being more impacted, then we have a social justice issue. When we have disparity in the number of people who are able to get access and use services, it's a social justice issue. And oftentimes, when we think about social justice, we kind of think of it as an afterthought, or we just wait until the problem gets so bad that we're forced to deal with it. And I wish that we just see it from a very proactive, preventative approach. I hope that after the presentation, people start to think not just like, oh, how am I going to serve Asian Americans, right? Really, that's not the point. It is to understand further a community that maybe has not been on your radar. But then the point, hopefully, from the presentation is for them to come back and start to look at a bigger approach in recognizing that how culture does influence the problem, and that not just the Asian American cultures, but then the Pacific Islanders. Then we have, all the other, BIPOC communities. And so looking at a more of a larger perspective and how can we always have this lens of equity, always this lens of cultural competency and humility, from that flows from the policy to the practice, to the service to the community. And so I hope it gets people to start thinking of what we're not doing, and I hope we start thinking bigger than just start thinking of like minute, or insert people in. I hope we start to prioritize fundings of where we think is important, right? And now that hopefully they do think this is an important area, and start to be intentional about supporting a plan of intentional research. If you don't collect data, you're not going to know the problem. All this is going to continue to be preliminary findings. This is going to continue to be anecdotal information. And so we really have to have the research going, but that has to be supported. And so we just need to be more intentional about understanding the challenges that our community members are going through, and be intentional about how we can provide policies and practices that really reflects the need of the community, and just not do it when it gets to these dire consequences and we're forced to. I hope I can start to shine a little bit more on the Asian community and their the problem, the addiction problem, or the gambling problem in the Asian community. But whenever time I talk about the Asian community, I always have to push out a caveat that say that this is the Asian community is very diverse, right? There are in Washington State, there are over 50 different what we call Asian Pacific Islander communities. And sometimes we are grouped differently, and we are grouped, as Asian Americans, we're grouped as Asian Pacific Islanders. And within those different communities, right, we are grouped purely when by race, it is like a social construct. And so we're grouped because this is how the government has chosen to identify us. But within the different ethnic groups, I would tell you there are so much difference in experiences, in values and beliefs. I think it's a starting point to recognize that, culture, our cultural values and history does influence us. And so it also, and from there, it helps us to see people, with their cultural values and beliefs.